Welcome to Stay Alive with Church Alive. And this is your host, Reverend Dr. Timothy Burkett. And our desire is to bring you information, resources, and services that will improve your lifestyle. And we've done that for over 25 years. This pandemic has created a lot of fear, a lot of activity, anxiety, and also it requires a lot of changes in our lives. And that is, we've adjusted to wearing masks. At least we all should have made that adjustment. We also realize that distance from one another is also important. But the other area is our hand touching, what we touch, what we pick up, and whether our hands are properly covered. And so we're going to deal with that today. And I speak that the information we're going to bring to you and the invention that is already available to you is going to really make a big change and give you a lot of comfort as far as sanitizing, covering your hands. We know that your hands are touched many, many things. And the way we've been using the plastic gloves to cover our hands, it's really been a chore, taking them off, putting them on. But I believe that we have an answer to that in this program. I would like to introduce my nephew. His name is Frederick Burkett, and I'm very proud of him because he's invented a life-changing, or certainly a life-saving glove that I know that will make a difference in all of our lives. And so I would like to introduce him to you, Frederick Burkett. Tell us a little bit about yourself. First of all, I want to welcome you to Stay Alive with Church Alive, okay?
Well,
And tell us a little bit about your background, and I'm really proud of the fact that you've done such a marvelous job in the educational area. And I believe that has a lot to do with allowing you to be creative and making a difference in the lives of people. First children, and now the whole world. Okay, Fred Burkett, welcome to Church Alive.
well, thank you, Uncle Timmy. I really appreciate this opportunity just to speak to you and your audience in terms of things that are happening out here. You know, we all live in this world in terms of events and things that occur. And it just so happens that we're living in a time now where we all are affected by this pandemic. What is this pandemic? It's called COVID-19. And we're all affected by it. And for me, as an educator, I do a lot of thinking about it. I'm born and raised in New York City. Matter of fact, I grew up in the Bronx. And so for 25 years, I lived in New York. And I often think about what it's like living there now in the midst of this COVID-19. And so as I thought about it, I kept asking, and actually I got on my knees and I prayed. I said, Lord, give me an idea that can help keep people safe. Give me an idea that can help us as a barrier against dealing with this COVID-19. And I remember this is back in March when we first all became really aware of it. Back then, I was still a school principal. I'm retired now, but I was a school principal last year. And I had to prepare my teachers, my students, and my families on how we were going to continue to educate their children in the midst of this COVID-19. As everyone knows, a lot of educators and parents and others are now that we're back in the school season again, everyone's trying to figure out, can I send my child back to school? Can I send him or her back to school safely? Teachers are asking themselves, can I go back to school and work in a school environment with children risking the possibility of either catching COVID-19 or maybe passing it on? And then parents are concerned about their children's safety. So I say all that to say this to you, that we are again living in a time where we are all concerned about what do we do to prevent ourselves from catching the virus. Now, although I'm not a scientist, at least not from the scientific community, I'm an educator. In fact, having grown up in New York City, I was fortunate enough to attend and get my bachelor's degree from Fordham University right there in the Bronx. And so, I began to become part of a research community looking at all kinds of things. And my area is education. And then as I began to continue to do my research in education, I was fortunate enough to go on to Harvard University and get my master's degree from Harvard University. And then during the time I was there working on my master's, we were taught how to research everything, do a lot of reading, do your homework. What are solutions to problems that we may be dealing with in a society? So I believe that my educational background, as well as I'm also an entrepreneur. I invent things and I reproduce things. I try to find a need and fill it. And so the combination of my education as well as my entrepreneurial background helped me come up with what I call not so much an invention as much as taking a product and repurposing it on how we can use this product to as a barrier against COVID-19.
Okay, I want to ask a question. Now, we have been told that the mask is very effective, and we were told that uh, social distancing was also very important. But
Mm-hmm.
there's some mixed feelings about hand sanitizing and products to put on your hands, and you should. And one time they said, well, it wasn't. You can't transmit it through
Mm-hmm.
touching things,
Mm-hmm.
and it dies on certain surfaces and things like that. Uh, what is really the last word from CDC? And then we're going to go show how your invention makes a difference.
Yeah, so what the Centers for Disease Control has told us, which is CDC, they told us number one, that we know that people can catch or give out the virus, transmit it through the air. That's called aerosol, by coughing and sneezing and breathing and things like that. We know that that's research that's tried, true, and tested in terms of how possibly we may catch it. But also what the CDC came out with was in looking at other ways we can catch it. It just happened. I was watching a frontline video last week, and they talked about the fact that, again, through the CDC, that the virus, when it does exist in the air, it falls on objects. Out of the CDC study, they found that the virus is actually detectable for up to 3 hours in aerosol. So that's the breathing, that's the walk, that's the talking and the singing and things like that. They also found out, though, that the virus is also detectable for 4 hours on copper surfaces, for 4 hours. Interesting. And then they found that the virus is detectable and can be found on cardboard for 24 hours. In addition, they found out that the virus can last up to 2 to 3 days on plastic and stainless steel. Now, as soon as when I read that report that it can last 2 to 3 days on plastic, on stainless steel, it made me even more concerned. We all go to the store every day. We all go shopping. We put our hands on shopping carts. We all, for the most part, especially in New York City, we ride the subways. We have to hold on to the handrails. We have to touch things. It's almost impossible not to touch things with your hands. And what the CDC is showing us is that what people tend to do is when we put our hand on surfaces where a virus may exist or germs may exist, we invariably, believe it or not, we touch our faces with our hands 200 times an hour. Imagine that. We don't know it, but we touch our faces 200 times an hour. So that means if you touch your face 200 times an hour, invariably you've touched something else. And if you touch some sort of a surface that has germs on it, you are possibly transmitting those germs to your face, to your eyes, to your mouth. And we know that that's the other way that the virus is being transmitted, from hand to face to mouth, things like that. So as I read that and listened to the CDC research, I said, gee, maybe we can come up with some sort of a barrier, something that can help us get away from getting germs in our hands.
Now,
And that's when, yes.
Before you go any further, because I know the minds of my audience is, well, we got plastic gloves. Isn't that enough? And I know that I've gone through the plastic glove situation almost like in madness, putting off, taking it off, where should I put it? Even after I take it off, where should I throw it? In the garbage can, in the street, whatever.
Yes.
What do I do with this contaminated plastic glove? So
actually,
I know it's misery for me, but I believe that you've got something to solve that. Go ahead.
Yeah. So I actually thought about that. And actually, just so happened, I happened to watch a YouTube where a nurse was demonstrating how you take off those plastic or disposable gloves. They're latex disposable gloves, how to take them off. The problem with the latex disposable gloves is you can actually get germs on your other hand as you're trying to take the glove off. Because with those disposable latex gloves, they kind of stick to your hand. So what you have to really grip them with your other hand to take them off. As you're gripping them, as the other hand is touching the glove, even if you have the glove on, then you're still going to end up with one bare hand and one hand with a glove on it. And I looked at that and realized, oh, that's a problem. So then I decided, wait a minute, rather than having a plastic or disposable glove, which is number one, it's not eco-friendly, it's not environmentally friendly. Matter of fact, what we're finding now in a lot of cities and states and towns is that you're seeing gloves dropped on the ground. You can walk around the city and see disposable gloves dropped all around the place, and even dropped in the trash and things like that. And that can, because the germs are still there, it can spread the germs. So that's when I said, wait a minute, we need to have a glove that's washable, that's reusable, and that you take off without getting any sort of germs on your hands. And that's when I came up with what I call the Sanitouch glove. Sanitouch glove. And it kind of, I don't know if you can see it. It looks, I'll put two of them on. And this is what they look like. Sanitouch gloves. Now, what's good about these is the fact that they're washable and they're reusable. You can put them in the washing machine, you can wash them by hand, and you can have them ready every day. Now, the other thing with the disposable gloves, as I mentioned, trying to take them off, normally you take them off like that. You pull them and you take them off. But with these gloves, I was able to design what's known as a glove laundry pouch. It's a pouch where you stick, I don't know if you can see it, you stick your hand inside the glove, and then you pull it off with the glove still inside the pouch. So your hand never touch anything. Then your other hand, you put your other hand in with the other glove on, and you do the same thing, and you pull it off, and now there's your laundry pouch. You take it, you close it, and you drop it in the wash, and you can wash it. Everything is washed. The gloves are washed, and the laundry pouch is washed as well. So I call that's called repurposing. I designed it as a glove that's reusable, washable, and we don't have to worry about ecology and environmental. We don't have to worry about people dropping them on the ground, because you're going to take it home and wash it and be able to use it the next day. So it's a way, I mean, ultimately, what are we doing here? There's no guarantees that people are not going to catch the virus. Even with the mask, we all wear these masks, and the masks are a barrier against catching or passing it on to others. These are all what we call barriers against catching germs. And so that's what this is all about. And I'm a firm believer that people using the mask, people wearing gloves, it will cut down the chances of getting germs on your hands, on your face, going into your system.
Okay, what is the reaction of people? So I want everybody to know that I have my gloves on. Okay, what is the reaction to people now in the early stages?
Sure.
I put them on, and I have a sense of comfort. I have a sense of I'm doing something better than putting on a plastic glove. And sometimes these plastic gloves, they slip off anyway. But I'm really appreciate these gloves because they're on tight, and they feel comfortable as well. And sometimes I know I have plastic gloves and they slip off, and and you have to fight with them even to keep them on. And then you put some of them on, they're so tight that you're looking to take them off before you do anything.
Exactly.
And then people have just say, well, I don't want to wear gloves at all, so I'll just go ahead shopping and whatnot. And then when I get home, I will, I'll sanitize and whatnot like that. Now, many times I've gotten home and I've forgotten all about that. I forgot all about, washing and whatnot, and I have to double take and race back, to the sink to do that. How does this approach that you have help that particular person like me? Okay.
Well, as an educator, I told you when we first started, I'm a school principal, at least former. I just retired in June, so I call myself a former school principal. But while I passed them on to my last school, the teachers that were at my school a few months ago, And they like having the gloves because it makes them feel comfortable. It makes them feel as though I don't have to worry about everything that I touch. Because as a teacher, you cannot sanitize your hands every minute of the day. You have to feel comfortable where you can do your job, work with children, work with the other staff, work with families and things like that, and not have to worry about, am I getting gloves on my hands? So teachers have told me it's a level of comfort that has brought to them where it's one less thing that they have to worry about in this COVID-19 time that we're living in. So there's a level of comfort and a level of assurance that people are gaining just by having these washable, reusable gloves that, and not to mention for teachers, they can't be buying, disposable gloves every single day. It can add up to be a lot of money. So by
Yes.
having something that's reusable, they don't have to worry about buying, 100 every month. That adds up after a while. And even though disposable gloves are pretty inexpensive, doesn't matter how inexpensive they are, that price does add up. And for teachers, $1 is a big deal. So it's a way for them to have comfort, as I mentioned, and for them to feel as though they're also saving money and not spending dollar after dollar for buying gloves that they need every day.
Very good. I think about the seniors, our elderly, and many of them, they cannot because of their fingers, for the arthritis and whatnot. It's hard for them to put on a plastic glove. They struggle with it. Sometimes the fingers are not in the right holes on the plastic gloves, and their thumb is in the wrong place, and they really don't have them on. Okay,
Yeah.
we're going to talk
Yeah.
about that. We're going to take a break at this time, and we're going to come back and we're going to talk about the other areas that this Sanitouch can be so important, especially those who are traveling on the subway, on the buses, and places like that. We're going to come back and we're going to see how this glove can make a difference in giving them a better protection and a serviceable item more than the plastic glove. We'll be right back in 1 minute.
I wear a mask for my fellow New Yorkers.
My mama, who's a healthcare worker,
nurses and doctors,
for my father,
for the marginalized communities who don't have access to adequate healthcare,
for my children,
my community,
essential workers,
transit workers,
the immunocompromised.
I wear a mask so we can get back to work,
go to school,
share a meal, see a movie,
hug my friends,
dance together, go to the theater,
see our families,
continue to show support, take care of each other,
save lives,
stay strong.
145 over 92.
180 over 111.
182 over 100. And I had a heart attack and a cardiac arrest. And then a stroke.
Your blood pressure numbers could change your life.
A lot of people don't understand, including myself, I didn't, now I do, the impact of having a stroke.
My memory is shot.
When I woke up, I couldn't speak.
If I would have followed a treatment plan, I would not be in this situation.
It's a tough journey.
Lowering your high blood pressure could save you from a heart attack or stroke. If you've stopped your treatment plan, restart it or talk to your doctor about creating one that works better for you. Start taking the right steps at manageyourbp.org.
It's a new life, but I'm going to make it better. I'm coming back. Ask your doctor, check your blood pressure.
Wash hands now. Wash hands now. Wash hands now. Wash hands now. Hand washing is one of the best ways to stay healthy all year long.
I love New York. We love New York.
We've been stuck inside our homes,
while our everyday heroes have been working overtime.
For New York to reopen
and stay open.
We all need to do our part.
And show that we care.
Look, man.
I wear a mask to protect you.
You wear a mask to protect me.
Let's all wear a mask
to stop the spread of coronavirus
and save lives.
When we show up in the mask,
we're showing up for each other.
Show your love for New York.
Because New York loves you.
Well, we're going to talk about who can really use these Sanitouch. I know I have two ministries in the nursing home, and two nursing homes, and I find out that and ministering to the elderly, that many of them have poor dexterity, and it's hard for them even just to pick up something. Yet they need to have a glove to cover themselves. Well, we know that the nursing homes are hotspots, and it still remains hotspot. How can these gloves make a difference?
Well, they can make a difference, number one, because they're easy to take off and put on. I made them where they are one size fits all, so that's not a problem at all. And the key is one size fits all, easy to take on and off. And in addition to that, they're washable. You drop them in the wash, done.
Now, I know that there are many travelers, people, thousands of people on subways, buses, all over the place, and you always had to grab a strap on that somebody touch you, or you're sitting in a seat or whatever it is, and you're always touching something to get in that subway. Tell us about that, and also the people who do a lot of service providers.
Yes, yes. So again, once a person puts these gloves on, he or she never has to worry, because, as you know, if you get on your typical bus, when you get on a bus, you have to walk up the steps to get to the bus to pay your fare. No, you always, for the most part, have to grab the handle of the bus as you're walking up the steps to the bus. You have to put your hands on it. You don't have a choice. How many other people have put their hands on that same handle that they've walked up to get onto the bus? In addition, if you don't get a seat on the bus, chances are you're going to have to stand. If you're standing on the bus, you have to put your hand on the pole. You have to put your hand on the handrail. That everybody grabs those handrails that you hold on to as you're traveling. And that's and again, for anyone traveling in New York City, you're touching all kinds of things. Your hand not only touches your face more than 200 times an hour, but you're touching physical objects, plastic, metal, copper, whatever. And again, as I mentioned earlier, the virus does stay on these things for 24, 48, and 72 hours, and 3 days in some cases. So germs in many ways are being passed on without us realizing that they're being passed on to ourselves, or we're passing them on to others. The key to all of this is a barrier, safety, no guarantee. In the end, I tell people, still wash your hands when you get home. Still use hand sanitizer when you get home. Still do those things, but at least you have to worry about it less at this point.
Okay, now I know my audience is saying, how do I get this glove? And we don't want to go off the air disappointing them. Where and how can you tell us the locations? And of course, in New York, Castle Laurel Uniforms. That is a 5-star uniform store located in Yonkers. We will have the glove there. But tell us other ways by which they can acquire these gloves.
Well, other ways you can acquire the glove is by going through our website. It's called Sanitouch Gloves at Shopify. So sanitouchgloves.com. If you go on there, just go online and you'll see them show up right there. And you can buy them right online very easily. And they're very inexpensive. We've had people buy them just in the past couple of weeks here. I had people buying them at least 2 to 4. I had one lady buy 30 pairs. I guess she wants to give out to friends and relatives. So people are buying them dozens at a time, which is really great, because they realize that it's not just for them, but for their friends, for their relatives, and maybe for their coworkers that they work with.
Okay, now besides the glove, you added something else, and I really call it as a gift for buying the gloves. Tell us about it.
Well, a couple of things. We give every person a free mask, because people still need masks. So you get a free mask with it, but also we have what's known as a stylus. I don't know if you can see this or not, and we have different ones. And the purpose of these is when you go shopping, when you finish paying for an item, you're going to have to punch in the keypad. You have to punch in either your credit card code or a code to pay for that item. These are called stylus. These you can carry with you anywhere. And you can take them into the store and you can use it and punch in the keypad and punch in the sale information that you need to buy the items that you are buying. So this is something that we throw in when a person purchases the gloves.
Okay, I think that's a wonderful gift item. The gloves are essential. Okay, and for you to add something, it's a way of saying to the people, I thank you for reaching out and doing something for yourself and for your relatives and for everyone. Well, tell us again, how they can get these gloves.
They can get them at the uniform store in Yonkers, New York. I'm sure you can give them the address and location of the uniform store.
Yeah.
And also online at sanitouchgloves.shopify.com. It's that simple. And we ship.
Great. Well, I'd say to my audience, you're out there, this can make a difference in saving life. This can make a difference for you, your friends, or your relatives. I feel especially a burden for the seniors. And I would say if you wanted to buy a gift for an elderly person in a nursing home, this would be a great idea to get them a set of gloves. And if you are a health provider or nurse's aide or home attendant, and you have to take care of the elderly, and you are concerned about any kind of virus, and we're coming into the flu season, so we have to be doubly careful. You got the flu season, you got the virus, and these gloves go beyond the latex gloves that you've been using. I highly recommend it to you, and I know it's going to be a blessing. Fred Burkett, we want to thank you for first listening to God and acknowledging the fact that this is what he wanted you to do for the needs of his people. Thank you very much. God bless.
Thank you. Thank you very much. Have a good day.
I want to take this moment to also announce to you that Church Alive has a prayer line. And there are many people that can't get to church, but you need encouragement. You need somebody to pray with you. Maybe you have the virus and you're concerned, is God really concerned about me? And I'll tell you, he is. But we have a prayer line, and God is using the prayer line. Many people have been blessed and healed. Many have been given their jobs back. They've seen the favor of God because they took time to pray to God. The prayer line number is coming up on the screen. We want you to call it. I'll be on the line to pray with you and take your prayer requests, and believe God for an answer. And he always has an answer. Thank God, and thank you for allowing us to come into your homes. And we close by saying, we love you with the love of the Lord. God bless.